Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and I'm going to update you again this week on all the key developments related to COVID-19. If you've been following our updates this week, then you're no doubt already aware that we launched our Return to Face-to-Face Care toolkit for members in England. It's a thorough guide designed to help practices return to safe clinical care. Roughly 10,000 of you have already downloaded the toolkit, so we hope you're finding it as useful as it was intended. Things are moving fast, and as of today, we've already published version 2 of the guide. New content in version 2 focuses on questions you've had about respiratory protective equipment, such as types of respirators, and what to look at for in fit testing, and more besides. So you'll find that, as well as the content from the original guide, in the second version, which is up on the website and available for members to download now. Guidance has been a bit like buses this week. The FGDP advice came out earlier in the week, and then NHS England's standard operating procedure also finally emerged yesterday. We've done our best to make sure that the advice is consistent, and we factored in the FGDP advice and what we expected to see in the SOP when creating our toolkit. So it should all work well together, and the toolkit should actually complement the other guidance. So the toolkit is for practices in England. However, we're working with members in the devolved nations on what approach will work best across the other countries. Also, if you're a good practice member, you can complete our assessment on returning to face-to-face care and receive a certificate to indicate good practice compliance, and that is also on the website now. So Monday, June the 8th, is the date that the government issued last week for dental practices to be able to return to face-to-face care in England. And we heard from more than 2,000 practices that a little over a third will be reopening on Monday. The barriers to returning to practice include PPE, which I'll touch on next, and other issues such as cash flow problems, difficulties getting practices ready for social distancing, and access to childcare. And on that point, whilst we had confirmation in March that dental teams were regarded as key workers, we know that some have continued to have difficulties, and this becomes an ever more important issue as face-to-face care expands. So we're asking for the simple, explicit addition of dental teams to the list so that children will not be turned away from schools and nurseries. Overall, around 2/3 of practices in England expect to reopen at some point by the end of June. Those returning will face issues around having fewer patients and higher costs, and we've been calling for vital support to help you through this. We're urging the Chancellor to keep up with the furlough scheme, which over 80% of practices have made use of, and not pull it away prematurely when clinical activity remains so low. We've had a lot of press coverage over these issues this week, and that should continue over the weekend, so please do look out for that. One dentist who will be opening on the 8th of June is Anne Grew from a mixed practice owner in North London. She's penned a blog for us on the serious challenges of reopening, from PPE to ensuring safety and managing patient expectations. So do read that. Also in the blogs for Northern Ireland, Tristan Kelso reflects on the challenges of returning to face-to-face care and the burning questions facing dentistry in Northern Ireland right now. A roadmap was set out this week for the restoration of general dental services in Northern Ireland, and that was shared with all GDPs on the 2nd of June. Personal protective equipment continues to be a major issue in the response to the pandemic. Our survey of 2,000 English practices found that only a third had sufficient PPE to provide face-to-face care on June the 8th, and it's one of the core reasons that many practices will not be opening on Monday. The Office of the Chief Dental Officer in England indicated yesterday that PPE for dentists would be available for practices to purchase from wholesalers from today, but we know some practices are continuing to face real difficulties in sourcing supply. Where PPE is available, it's becoming prohibitively expensive, and we've been calling on all countries to follow the Scottish lead in helping practices to source affordable PPE. And that point was one of the main focuses in our response in Northern Ireland to the publication of the roadmap for the expansion of care. Meanwhile, we've created a webinar and CPD training module on using PPE safely, which you'll find on our website. And next Friday at midday, we'll be running another webinar with the Institute of Occupational Medicine on respirators and face fit testing. And booking is going to be available on that on the website shortly. CDO for Scotland, Tom Ferris, and National Clinical Director have confirmed that wholly private dental practices in Scotland can reopen as long as appropriate measures are in place to ensure patient safety. However, it's worth noting that there are a very, very small fraction of the 1,100 practices across Scotland. We await an update from the CDO about when NHS and mixed practices can open, but we understand it will be sometime later this month. In the meantime, in Scotland, please refer to the SDCEP Return to Practice Guidance to prepare for reopening. As part of that preparation today, the National Services Scotland, NSS, distributed 3 million individual items of PPE to dental practices across Scotland. We understand that those items of PPE are currently en route to the 1,100 practices. Welsh CDO Colette Bridgman has confirmed that the de-escalation phases in Wales apply to NHS and private treatment equally, on the basis that the approach is first and foremost a public health one. And the current plan is that from the 1st of July there could be a greater scope of treatment. Colette's acknowledged the financial impact that this has on private practitioners in particular, but it's confirmed that Wales is making progress to return to service. She's encouraged dentists this week to take advantage of the Attend Anywhere software that the Welsh Government has purchased and made free of charge to dentists in Wales in order to hold remote consultations. So that's all from me this week. Good luck in particular to those practices returning to face-to-face care on Monday. We will of course continue our work on your behalf, and I'll be back next week to update again. In the meantime, have a safe and healthy weekend.